This medication is used to provide protection against certain virus infections in people who have not been vaccinated or have not had the infection before. It is also used to strengthen the body's natural defense system to lower the risk of infection in persons with a certain immune system problem. This medication is made from healthy human blood that has high levels of certain defensive substances, which help fight infections. Routine vaccination is usually the best way to protect against infection. This medication is injected into a muscle as directed by your doctor. The dosage and schedule of injections depends on your medical condition, weight, and response to treatment. Large doses, more than 10 milliliters, should be divided into 2 or more injections and given at separate injection sites. This medication is given as soon as possible after you have had contact with, been exposed to, someone with hepatitis A, measles, chickenpox, or rubella. If you wait too long after being exposed, the medication may not be effective. Not everyone who is exposed to these infections should receive immunoglobulin. Discuss the risks and benefits with your doctor. If you are traveling to an area where hepatitis A is common, this medication may be given along with the hepatitis A vaccine, in a separate injection. This medication will help protect you until your body can make antibodies from the vaccine. If you cannot use the hepatitis A vaccine, you may need to receive more doses of immune globulin if you are staying in the area for a long time, more than 3 months. Do not receive live virus vaccines, such as measles vaccine, at the same time as immune globulin. See also Precautions section. Ask your doctor or pharmacist for more details and a recommended vaccination schedule. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check this product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. If you are using this medication for an immune system problem, it is given as directed by your doctor, usually every 3 to 4 weeks. Use this medication regularly in order to get the most benefit from it. Keep all your medical/lab appointments. Some side effects like muscle stiffness, redness, fever, chills, headache, and joint pain may occur after receiving the injection. If any of these effects persist or worsen, inform your doctor or pharmacist immediately. Also, remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as unusual tiredness, changes in urine, sudden weight gain, or signs of a serious allergic reaction like rash, swelling, severe dizziness, or trouble breathing, contact your doctor right away. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not mentioned, contact your doctor or pharmacist for advice. Serious blood clots may rarely occur with this medication. Factors that may increase your risk include older age, severe dehydration, use of estrogen-containing products, and certain medical conditions such as a history of blood clots or heart disease. It's important to discuss these risks with your doctor before using this medication. Staying well hydrated can help reduce your risk of blood clots. Seek medical help immediately if you experience any of these serious side effects. Before using Gamastan SD Vial, talk to your doctor or pharmacist if you are allergic to it or other immunoglobulin products, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems. Tell your doctor or pharmacist your medical history, especially if you have a certain immune system problem, bleeding or blood clotting problems, or kidney disease. Inform your doctor of any recent or planned immunizations or vaccinations. This medication may prevent a good response to certain live viral vaccines, and your doctor may need to test your response or have you vaccinated again later. Since this medication is made from human blood, there is an extremely small chance of getting infections from it. Before surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, use this medication only when clearly needed and discuss the risks and benefits with your doctor. It is unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware that Gamastan SD Vial may interact with other drugs, which could affect how your medications work or increase your risk for serious side effects. This is not a complete list of all possible drug interactions, so it's crucial to keep a list of all the products you use and share it with your doctor and pharmacist. Remember not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Gamastan SD Vial include drugs that may harm the kidneys, such as aminoglycosides like gentamicin. If someone has taken too much Gamastan SD Vial and is showing severe symptoms like fainting or difficulty breathing, it's important to call for emergency help right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. It's important not to share Gamastan SD Vial with anyone else. Your doctor may also want to do some tests while you're taking this medication, like checking your kidney function. Make sure to keep all your medical appointments and talk to your doctor if you have any questions. If you need protection for longer than 1 to 3 months, you may need to get more doses of Gamastan SD Vial. Talk to your doctor about what's best for you. Remember to store Gamastan SD Vial in the refrigerator, but don't freeze it. If you have any leftover medication, be sure to discard it. And always keep medications out of reach of children and pets. When it comes time to dispose of the product, make sure to do so properly by consulting with your pharmacist or local waste disposal company. And never flush medications down the toilet or pour them into a drain unless instructed to do so. It's important to properly discard the product when it's expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.